Hi, I'm Summer May Finlay. I'm a Yorta Yorta woman, and we are at the International Indigenous Health and Wellbeing Conference, and I'm with Jaqui Hughes, and we've just been talking about the work that she's been doing in Catching Some Air, which is about renal disease in Aboriginal and Torres Strait Islander patients. So you were actually telling me one component of it was about the developing guidelines for Aboriginal and Torres Strait Islander people for the first time. Can you introduce yourself and then tell me about that, because I can't believe that that's the first time we're doing this.
Thanks, Summer May, and I'm proud to be here at Darwin at the Lowitja Institute International Indigenous Health Conference. And on Monday we launched our talking report for Catching Some Air. We were given authority to go and consult with Aboriginal and Torres Strait Islander people who live with kidney disease to ask them their recommendations for the very first guidelines for kidney health, the management of chronic kidney disease, but also about how we use data, which is routinely collected, about people with kidney failure treatments.
Yeah. And so you're actually saying that one of the principles that you're building in is data sovereignty. Can you explain how you're doing that with an existing register?
So we've reached the point today, after 15 months of consultation and interpreting that information, about where do we go with a register, a really important clinical quality registry that's been around for 40 years. What do we do with the data that we have already and the information that we really need to explain health advancement for people at risk of kidney disease? So we were consulting with an expert advisory panel, but also with patient users across 3 really important regions who have a really important expertise around kidney disease, about how's the information collected, how is it stored, and what the processes should be, which would reflect data sovereignty, that is control, decision rights, authority to use, interpretation, and how that can be powerfully transformative for the policy and action we need to have that we don't quite have yet, but we know we need to achieve it.
Fantastic. So you've talked a little bit about the process and what you were collecting. Can you tell us any of the outcomes, or are we not allowed to hear any of those just yet?
No, we're really proud. We've launched our report and it's all up on the Menzies website, and inside in the auditorium we've got a big banner and that articulates our principles and our we will statements.
Fantastic.
So the first recommendation is that Aboriginal and Torres Strait Islander people assert their rights to renal health, optimal renal health, and that we do assert our rights to processes and to lead work, and we recognise that we need to create accountability processes in. Everyone's doing a lot of important work, but we need to see the results of all of that cumulative work, and Aboriginal and Torres Strait Islander people want to have healthier families and healthier futures, and we're not quite at that stage yet.
No. And one of the other things we were talking about as well is Indigenous researchers, we obviously have a responsibility to community and the knowledge translation component. And you were saying that you've done your peer-reviewed articles, which meets your academic stuff, but you're also doing some stuff as well for community. Do you want to share a little bit more about that and why?
Reporting and things in the publication, and that you can find your evidence wherever it tracks. And I also have an obligation with the kidney health community that we write stuff in a way that the kidney health community can access. So that was writing articles and talking about it like that. But all the way along the project we included Aboriginal and Torres Strait Islander people, including in our investigator group and in our steering committee. And we have recognised leaders in each of the 3 regions that we went to. And when we designed the talking report, which was yesterday, which was led by our investigator Leanne McRam-Sammy, we had live sites to Alice Springs and to Thursday Island, where people were also involved and contributing in that dialogue. And we had affirmation of the principles and policies and we will statements.
Fantastic. So technology is really helping you actually connect those communities that sometimes are hard to connect with, particularly when you're in a place like Darwin. So
I guess the important thing was that we really invested in connecting with Aboriginal and Torres Strait Islander people where they lived. They designed the processes where we engaged with them. And it's not possible, feasible or efficient for people to travel long distances, and nor are there enough dialysis chairs in places for people to be able to travel safely.
Absolutely.
So technology is important, and we used that on Monday with our talking report so that we could incorporate the voices of people all the way along. So emphasising transparency in creating policy and the voice of Aboriginal and Torres Strait Islander people the whole way through.
Fantastic. Is there anything else you want to add about the report? And I know you're going to send a link out after this with the report in it, but is there anything else you want to mention?
I'm just really proud of our partner, the Australia and New Zealand Dialysis and Transplantation Registry. It's a clinical quality registry, so our governments require that our healthcare system has monitoring systems, and that's what ANZ data does for kidney disease, people on kidney failure treatments. they're such a tremendous registry because they've had an Aboriginal and Torres Strait Islander health working group for 10 years.
Wow.
And that's really significant because other registries don't have working groups like that.
No, I don't know. Yeah.
And the Aboriginal and Torres Strait Islander health working group within AND's data are led up by 2 Indigenous women.
Fantastic. Awesome. Thank you very much for that. And if you can tweet me out the report, that'd be great so I can have a sticky beak.